The particular project that we are working on for the Ministry of Health and the MBS has this particular objective. We're not here to try to solve all the problems of the health system. Now, to suddenly remove all chronic diseases or infectious diseases from the population, we can't do that. Our scope of work is a bit more limited. It is a step towards all of those, but it is a vital step. We're here to try to develop the documentation, the sharing of information, the capacity building with the MBS and other organizations to advance towards universal coverage by providing that support to transition to a full NHI. So you expand coverage, you increase access, you reduce out-of-pockets, you develop your single-payer system. This is what we're here to do. And some of the core activities which we have that we'll be engaged in, defining that burden of disease. If you want to link your package of services to health needs, let's define the needs much more tightly. Second thing we want to do is in relation to the package. Let's define the package. At the moment, there are a number of things which are being offered in the public sector, the private sector, the non-governmental organizations, international organizations sometimes coming here to offer services. We want to look at all of these and see what is the most appropriate package for Antigua and Barbuda, given the burden of disease that you have in the population. The third dimension, the third aspect of our work is to try to make sure that having defined the package and pointed out that all persons should have access to the package, how do we relate to the financing side? What are the financing options? Is it going to be more money from people's pockets? Is it going to be other types of arrangements that we put inside of there? Is it going to be more efficiency in our operations? How does that fit into the overall macroeconomic and macro-social setting that we have? And that's part of that third major task that we'll be engaged in, so that you get the right fit. Financing option related to macro-social developments, related to the package and your burden of disease. The fourth dimension of this is that we really want to make sure that the legal framework, the policy, the regulatory, the legal sides of this are in place. Professor Theodore pointed out that for you to have a system that is visible, that is transparent, that is accountable, it has to be rooted in legislation and regulation. And that's what we want to build into this. How do you administer this? Does the current administrative arrangement at the MBS, is that adequate, or does it have to be changed or modified? And how do we begin to draw attention to what are the critical aspects of that overall governance and organizational structure that will be needed for these? And lastly, in all of this, as Dr. Cumberbatch and Professor Theodore pointed out, that whole matter of the information system. So really, we will be working on 6 major components of what you want to do. During the course of our work, we'll be interacting, we'll be sharing information, we'll be bringing data sets from other countries within the Caribbean, from elsewhere. Because we have also done work with the WHO, with PAHO, with the World Bank. We'll be bringing all of those resources into the mix so that we can share that information, we can build on what you have, we can fill the gaps, and all together we can do a major exercise for the government and people of Antigua and Barbuda to move you towards the road of universal health coverage. The plan then is for us to have a made in Antigua and Barbuda for Antigua and Barbuda plan.